Good morning, everyone. Welcome to the 7th webinar in our 8-part webinar series, Communication Strategies for Community Outreach and Education. Today, we'll be learning telehealth strategies to build understanding and acceptance internally and externally. My name is Kim Norden, and I'm a program coordinator for the Delta Region Community Health Systems Development Program, or Delta for short. We designed these webinars to be interactive, so we'll be asking you to complete some polls and participate in some chat box discussions. You may unmute your line and use your voice to speak at any time. If you haven't already done so, please add your name, title, and organization to the chat box, which you'll find on the bottom of your Zoom screen. The slides for today's webinar can be found on the event page. I'll put the link in the chat box. If you have any questions or comments today, feel free to use the chat box at any time. We'll save some time at the end of this webinar for our speaker to answer any questions that come in through the chat box. To avoid background noise and feedback, please remain muted when you're not speaking. Now, let me introduce you to our speaker, Mike Milligan, President of Legato. As a healthcare communication strategist, educator, and media trainer, Mike has directed strategic planning efforts for a variety of rural and other healthcare organizations, serving as counsel for CEOs and other executive team members. Mike is a highly requested speaker for healthcare national conferences, and he is a regular contributor to industry publications and blogs. Before founding Legato, Mike previously served in a communication leadership role for Previa Health in Green Bay, Wisconsin, and Director of Public Relations and Strategic Communications with Aurora Healthcare in Milwaukee, Wisconsin. When he's not writing strategic communications plans, Mike spends time with his family fishing, kayaking, and hiking with his 2 golden retrievers. Thanks for joining us today, everyone. Now I'll turn things over to Mike.
Thank you, Kim. Good morning again, everyone. Hope everyone's doing well. Yes, those hobbies that we talked about, and as I've mentioned before, I'm anxiously awaiting adding snowmobiling to that list of activities in northern Wisconsin, and we're a little behind on the snowfall, so I'm ready. So anyway, thanks again, everyone, for joining us today. As the title implies here, we're going to be talking about telehealth. And I know that is near and dear to many of you because I know that you're at various stages of implementing a telehealth strategy, and we'll talk about that in just a moment. And what we're going to focus on more here today is actually more relating to the communication of telehealth. And as we'll talk about here in a little bit more detail, the communication is certainly, yes, it's the communication that we would have with prospective patients and existing patients, which is certainly important, but it's also the communication that we have internally. And part of the reason why I say, depending on where you are in your journey in telehealth, is that there's different levels of acceptance of telehealth in various organizations, and you maybe are nodding your head or experiencing that now, and sometimes that comes from different providers who have different perceptions or what have you. And so when we talk about communication, a large part of sometimes implementing a successful telehealth program is it's not so much promotion as it is education. So again, we'll talk about that more, and obviously as we have some discussion points here, and if you want to bring up your experiences, that's kind of what this is all about as well, is to share with one another. So moving ahead here, hang on a second here. There we go. That's who I am. So again, we're pleased to be part of the Delta program and to provide this service to you. And so in terms of our agenda, I kind of highlighted a little bit here, but we're going to talk about in general, the new opportunity for telehealth within rural health. And, we talk certainly a lot more regarding telehealth having to do with, it's been more on the forefront because of COVID, but there are so many applications of telehealth outside of COVID. It's just that it's actually kind of, I guess you could say, a silver lining a little bit, has kind of made us more cognizant of the benefits of telehealth. But also, as we'll talk about, there are some barriers as well, and there's some things that we need to be aware of, and really to be transparent about as well as we're communicating internally. But then we'll talk about some different techniques or steps for implementing successful communication around telehealth, and specifically share some examples of some tools that you can use or think about, or at least give you ideas of ways that you might adapt tools that you're going to use. And then, as I've mentioned, to really be thinking about, okay, and what is the implication of telehealth in my organization beyond COVID-19? And certainly, as you're working to implement your program, you certainly should, if not, be thinking long term. Again, there's immediate actions that you may have put in place, even if it was seemingly at the beginning in a temporary state to maybe deal with overages of demands due to COVID-19. But again, thinking more strategically and more broadly about how to use telehealth in your organization is the long-term strategy we want to be thinking about. So kind of just to get us started, get us grounded a little bit, if you could just answer this poll question for us. And the question is, how confident are you in your understanding of how to effectively communicate and build awareness of telehealth services, both internally and externally?
And we'll just give folks a moment to answer this poll. Looks like we've already got 70% of people who have completed the poll. And most people right now are at medium confidence, some low confidence, and one person at high confidence.
Excellent. Great. I want to talk to the high confidence person too, because maybe there's some things we can learn from you too.
Yeah.
So that's great. So good. No, that gives me a perspective, and this is one training session and one webinar, but hopefully after just completing this will help you get on your way of feeling more confident. So that's great. So, all right. So as we've kind of talked about, using telehealth services, for primary care and for specialty care. Now, interestingly, as we're well aware, telehealth has been around for quite a while, and in some ways, we're maybe accustomed to thinking about telehealth from a specialty standpoint more than we have been from a primary care standpoint. And that's because historically or traditionally, we think of telehealth as provider to provider, maybe of how you're connecting in that way, and maybe don't think about it as much as a patient interface. And even if you've advanced in your thinking, sometimes our providers or clinical staff maybe haven't evolved their thinking in that regard as well. So they have certain paradigms about what telehealth is or what isn't that and the reason I bring this up, and maybe you don't have any of this in your organization, which is great, but I'm just speaking from some experience. We've worked with a number of organizations in terms of helping them implement and communicate telehealth programs, and we see varying levels of acceptance, and certain barriers. And so, but again, I think it's really about education, if anything. I think when, in particular with providers, once they're equipped with the facts and maybe the science and what the data says and those types of things, again, with as I'll talk about here in a minute, but complementing that with transparency, to let people know, okay, what are the advantages, but what are some of the drawbacks that we need to be aware of as a team as well. So again, to kind of set the stage, again, you're at various levels, and we'll talk about that in a moment, but certainly with the passage of the CARES Act, along with different federal and state actions, we have a little bit more of a clear path in terms of what our implementation is, and equally as important is, some now advantages in terms of reimbursement as well. I think in general, and you're seeing this as you're closer to this, that there were certain reimbursements that were put into place as a reaction to COVID, but some of those things are not going away. I think that there are certain things that are being adapted in terms of being able to still have an advantageous reimbursement policy. We at Legato are not experts in the reimbursement area or what have you. We're more on the lines of the communications, but through our work, with various organizations, that has certainly come into play. So to kind of start out again, as I've mentioned, we're in different stages, but if I could just get a gauge a little bit. Next question I have here is, if you could answer the poll question, is, as a rural health organization, are you planning or have you launched a telehealth program for primary or specialty care?
And you can feel free to drop your answer into the chat box, or you can unmute your phone line and talk with us.
Yep, either way. And I appreciate the comments in the chat. If there's anything specific, like if you have done specialty but not primary, or if you've started or you've just launched, just any detail would be helpful too. So far, I'm seeing a lot of yeses, which is great. Lots of shy people. No one wants to speak up, though, huh? I see lots of yeses, and I see a planning stage from one. So sounds good. Yeah. So the answer to the yes means either you are planning or you have launched. I guess it's yes to either, but. And again, if anybody wants to chime in on the phone, feel free to do that. So generally what I'm seeing here is, as we kind of suspected, at various levels of the process, number of people that are in the planning stages, which is why I hope you agree, this webinar is really good timing as well. And as we'll talk about in a moment too, as you're aware, I believe, we're also developing for you a communications toolkit, and one of the aspects of that toolkit is some materials that you will be able to use for telehealth as well. And it won't, there'll be certain materials that can be applied, and then if there's things that need to be customized and things like that, those are things that we can talk about. But hopefully, we'll give you some gauge of what's needed and what you can use. So again, I'm going to move on then. So thank you guys for the response on that. Looks like, obviously this is a topic of tremendous interest and timeliness, and people at different stages in terms of, but I didn't get any no's, which I didn't expect to. But again, most people are in it or in different stages of planning. So that's awesome. So what I'm going to share with you now, again, knowing that you're at different stages, but kind of keep in mind that what I'm sharing with you today, maybe things that but it also might be an affirmation for you as well, but also to keep in mind that, as we kind of talked about, that you as a communicator may be in a position to help educate others. And so just sort of having some of this as background, or also, frankly, to share this actual presentation if you'd like. It might be something that we take and adapt or whatever you want to do, but you have permission to use this. So if you want to use this internally to share some background and some information, absolutely do so. And you'll see here as we get into this a little bit more that it's sourced in terms of some background, some articles and things like that generally provider audiences like to see. So in terms of some of the benefits, again, keeping patients at your facility rather than having them transfer out, absolutely. Improving access to specialists and primary care, reducing wait times, reducing practice overhead, improved healthcare outcomes, and particularly in, some providers may argue with that a little bit, but in terms of, if you look at some of the areas that require certain follow-up care and things like that, where maybe people wouldn't actually even be coming, for instance, maybe monitoring the progress of someone who has diabetes as an example, and being able to, monitor blood sugar levels and all those sort of things. Overall, as an organization, reducing hospital readmissions and certainly avoiding the cost of having to travel. Again, this is in line for either specialist or primary care. Now, as I mentioned, and I'll be curious when we, and actually I'll go through these, and maybe just for a second, I'd be curious. So this is going to open up the phone lines for a second here. Well, they are open already, Kim, I know, but maybe to get people to respond to this. But these are some of the things that, that we hear sometimes, particularly from providers. The study here actually done in 2020, so very current. But generally, 22% of providers say it doesn't fit their workflow, or their patients aren't interested in telehealth, which we know is not the case because our patient data tells us differently. 33% express concern about privacy and data security, and 36% say they're concerned about medical errors. So not trying to take away those concerns at all, but just to say that those are things that you can most likely counter as well. So I'd just be real curious, just for a moment, if anybody would be able to just chime in, you just over the phone, and just are you hearing these types of things, or if not, what are you hearing in terms of any resistance that you're hearing at this point in the process?
This is Pam. I would just say that probably those top three are probably the ones that I hear the most,
Okay.
Not necessarily about medical errors, but
Okay.
more their workflow, their patients not interested. They just, some of them are just, I don't want to say older physicians, but they're older providers and they're more touchy-feely and,
Sure.
that kind of
Sure.
thing.
Yep. Makes sense. No, thank you, Pam. I appreciate that. So if anyone else wants to chime in, feel free to do so at any point. Otherwise, I'll just kind of keep moving along. But thank you, Pam. So having said all that, and this is where I kind of talked about at the beginning, that we want to be transparent. Certainly as communicators, various roles in our organization, administration, what have you, we're looking at what's good overall for the organization. But as we're having that dialogue, we have to remember that telehealth we look at it as a complement to the services that are being provided. It's not a replacement. So it's not the end-all answer for all audiences. So as an example, as we know, telehealth requires patients to have access to technology, oftentimes a strong Wi-Fi or broadband signal. We know that based on where you might be in your part of the country, in particular rural areas, sometimes are more challenged by this, that it does offer some challenges. So again, to acknowledge that, but it doesn't mean that it's not a useful tool either. And telehealth may be more out of reach, as I mentioned, for individuals facing social factors of health, and might be low income, things like that, just depending on their access and such. So just to be cognizant of those facts. We look at a current study this year, just kind of looking at the data again, very, very relevant. In terms of usage by generation, though, and you can see how it sort of counters a little bit, maybe some of the objections that the providers have had, but people are using telehealth. The exception that probably wouldn't be a big surprise would be over the age of 65. But we say here in our data only 24%. I guess you could argue that maybe could be a good number, a high number as well. It is 24%, but it is something that we need to be cognizant of, and it might mean one, how we certainly our messaging and how we reach people and all of that as well, and that we might have to overcompensate by making people more comfortable at certain demographics and things like that. So just again, or how we provide our services, just things to be cognizant of. Language determined whether or not people were going to use telehealth. In particular, the study showed that Black American patients are 4 times more likely to access the emergency department over telehealth than their white peers. So again, something to be cognizant of as well. So, and in fact, when you receive it, if you haven't already, Kim, I think this article I think was attached, but if not, there's a link from this, or we can get it to you. But this particular article goes into a lot more detail than what I just referenced. So as background as well would just be helpful, to learn that. So now I'm going to transition a little bit so that was a lot of the background, kind of giving you the situation, some things that we need to do. And I did notice here, Kim did put on the chat box here as well, access to the slides and a link to that. So, but So let's kind of go through some of these steps, and keep in mind again that these communication steps are provider related and they're patient related. Okay, so you thought we were going to get away from all these conversations about objectives and strategies and all that, but I look for every opportunity to bring them back. So, so for those of you that were, on the other webinars in terms of planning and how we think, we kind of use that same methodology in whatever we're doing. So when it comes to telehealth communication, we want to look at what our objectives. And broadly speaking here, increasing our visibility and our awareness of our services, both internally and within our community, and then to drive the utilization of those services, both by patients and providers, and then to grow the reputation of our organization. This in some ways, really helps to elevate, in particularly rural health, where sometimes we overcome sometimes unfair misperceptions of who we are, who we aren't. And I think by actually being able to demonstrate and show innovation and broader access to care through telehealth really does help to elevate the image of rural healthcare organizations. So again, looking at, defining those target audiences. So as we've mentioned, it's not just patients, staff who we may need to help to execute the telehealth program, referring providers, healthcare consumers themselves, and maybe people who influence that decision. When selecting the right channel, again, as we kind of talked about in our planning, we need to talk about that target audience. So there may be slightly different messages, for instance, for ages, or absolutely for languages, geographic locations. Certainly as you think about it as a patient or a non-patient, it's not necessarily always one message fits all. So for instance, as you can think about it, maybe you're communicating through your EMR and you're communicating directly to a patient, there's a certain tone and a certain message as compared to maybe someone who is new to your system and you're convincing them to join, to be a patient of your organization. They might be slightly different messages. So I mentioned before in terms of rural communities and different influencers. So just as we think about that in your daily work of all the different organizations with whom you come in contact with, whether or not they're social service agencies, community-based organizations, or faith-based organizations, that again, your points of contact there, that they are aware of what services you have, not only so that you can work together on behalf of patients, but just so they're generally aware as well, so that when they're working with people that maybe are underserved or not able to reach your facility, what have you, that they are fully aware of not only what you're providing, but how to kind of put those patients in touch with you for patient care. So in terms of also, building awareness through effective messaging, is that the message is to the values that most consumers are seeking most. So in other words, a lot of times in communications and education, we have a tendency sometimes, and particularly as clinicians, to get to the facts, state what the treatment is, et cetera, and particularly in healthcare communications, and obviously in healthcare in general, emotion is one of the strongest ways to deliver a message and have people receive that, and empathy. So when we talk here about calming patients' fears by leading with safety, security, and comfort, certainly there's lots of details in terms of, how do you use this technology and whatever it might be. But the key first is calming their fears, meeting their needs, those types of things. And then you can get into those secondary messages. So, and we'll show you some examples of that here in a minute. But so we want to support those emotional benefits then with the functional benefits, such as convenience, services offered, access, those types of things. Okay, and again, we talked about understanding your target audience for the most appropriate messages. But then as we look at that, what are those differences? Some audiences won't be more focused on specialty care. some more in primary care. So again, it's, it's sometimes, it's helpful when we look at our messaging to say, okay, let's communicate that we have telemedicine. But we always have to go back and say, I mean, not to be crass about it, but sometimes like in what we do for a living as we're helping to communicate, we ask this question, which is, why should they care? So in other words, we know they care, but when we look at the message, we say, okay, let's give them a particular reason why they should care. Okay, so we have this broader thing that we're marketing for telemedicine, but let's market more of what the benefits are. What are they looking for? So others might be interested in managing certain chronic health conditions, and as we talked about, some may be using telemedicine more for primary care and the conveniences of that. So again, a little bit more into the communication. This is kind of more in the visual aspect. Again, kind of supporting what I was talking about in terms of not getting into too many details at once, but this in particular is more of a how-to sort of thing, so we need to do that. But the point here is that, using visuals to your advantage. Obviously, when we're talking about telehealth, it's an obvious visual of video. So, but here you can kind of see this as an example of how to keep the message simple, non-threatening, those types of things, but in terms of giving tips and those kinds of things. And then to humanize it. So again, we talked about empathy, talked about how to personalize things a little bit. And yes, we're talking about telehealth and we're talking about technology, but first and foremost, we're talking about people's health. We're talking about their emotion. We're talking about, who they are as an organization or as a person, and how they can improve their health. So that really, is the focus, what should be the original focus of some of the messaging. Now you'll see here that this study was actually in 2019, kind of pre-COVID, and even at that point, 3 of 5 said they would not try telemedicine. Well, that sort of counters a little bit with what they actually are doing already. So I think that we have they have acclimated in those terms, but I think it still means that they need to continue to be educated of the benefits of. And again here, this part in terms of humanizing it, and I'll show it in just a second here, but sometimes, understandably so, there's this perception that telemedicine is impersonal. It's video, what have you. But certainly for all of us who probably in our business experiences have been doing a lot more Zoom calls and all those types of things, that we're a lot more accustomed to video, and really realize that in some ways, video, it's not the same as being able to touch someone's hand or what have you, but there is a personal part of this. We can see people, we can see their environments, those types of things, and we can see expressions and all of that. And so that's what still is really important in the telehealth part of things. And we'll talk in a second about some etiquette types of things that providers can do that help to really communicate that empathy in patient care. So as an example here, in terms of humanizing things, you can see here this particular ad that is adapted so that the actual providers are in the ads, just to really, wouldn't necessarily for this, may not use stock photography, for instance, because if we're really trying to humanize it, we want that to be the actual providers. So again, as we kind of look at how to make things simple for different people, so from a patient perspective, we want to make sure patients, they're easy to find us and our services, and that's especially true, obviously, for telehealth. So how do they access this? Like anything else, the more, whether or not it's in healthcare or it's anything else that we purchase as consumers, the reality is that if it's cumbersome, we won't do it. If it's confusing, we probably won't do it. We'll put it off, what have you. We have to make it as easy and accessible as possible. So even as we do set up our telehealth services and we think that we have it worked through, we definitely need to test what our process is. We need to, pretend, that we're patients and have someone do that and experience that. And what are all those dynamics that happen? So are they accessing it through your website? How is that working? Then there's certainly the communication part of it, is how are we promoting the access to this service through our digital efforts or what have you. And from a competitive standpoint, obviously we're doing this for patient care, but again, as we look at trying to elevate our particular rural healthcare organizations, our competitors may be doing telemedicine and telehealth, but if we are doing it better, all the better for us in terms of how we're making it easy for our patients, how it's being accessible, how participatory our providers are. That whole experience overall speaks well to the image of our organization. So then kind of moving more specifically to some of those tools that I've kind of shared and have alluded to a little bit. So I'd like to start out first with just kind of getting a gauge that many of you have been, like you say, you're in different stages. So I'd like to just learn if you've launched a telehealth program, what tools are you currently using, or maybe what tools are you considering? Because that's going to be helpful too, because I think, frankly, even, and as I mentioned, we're going to be doing we're in the middle of designing the communications toolkit for you, and we have certain ideas of what we're going to be producing in terms of helping you to communicate telehealth. But if you have specific needs, either through this or obviously communicate to the staff later. But anyway, if we could just open up the chat box or certainly just chime in, just love to hear a little bit about either, again, if you've launched a program already, what tools have you used? Or if you're considering and you're at a different stage of launching, what kinds of communication tools are you considering using?
And again, you can use the chat box or you can unmute your line and talk to us. This is a really good opportunity here to kind of check in with the expert Mike and ask any questions too, if you have any at this point.
Okay, so someone referred to DoxyMe. So that is a platform for providing the service, which is great. And what I'm referring to more is, and Lisa's responding here and said, social media and paper handouts for in-person visits are kind of more what Lisa is responding to, which is the types of tools that we're looking for or that we are currently using. So Lisa said, again, she's using, I don't know if she is or she's considering, but using social media and handouts for the in-person visits. Okay.
Hey, Mike.
Yeah,
Hi, this is Brian.
Oh, everybody, this is Brian. Everybody remembers
Hey,
Brian?
I'm back. One thing that in pointing out with DoxyMe, we have worked with clients that that did utilize the product DoxyMe, and DoxyMe does have a toolkit also. So within that, they do, in reviewing the information of DoxyMe, they do have some very good tools that are within there, and there has been things that we've adapted from their product within that. So it is a good base to look at for information with that product.
Yeah, we've actually adapted them for those organizations that have used DoxyMe, right? So we've used like for them. So if they've exactly to kind of maybe more customize them. No, thank you, Brian. Good, very good point. Yep.
Okay.
Yep. Like, where did that voice come from? That was Brian. Okay, see some other answers here. Social media, advertising in the local newspaper, handouts, or electronic sign. Excellent. Some social media handouts, hospital website. Perfect. Perfect. Good. And if there's, if anybody wants to either put in chat or just over the, the people who have chimed in, just to give me an idea, are these things that you're already doing, or are they what I'm looking for as well as we're kind of thinking about what would be the most helpful tools to develop for this toolkit. If there's anything that currently isn't provided, but you would think would be very helpful, and maybe that is part of what your answer is here already. But if anybody wants to clarify or chime in, and again, you can call me later too, but just any other insights would be helpful. So Brad and Lisa and Pam, Lisa, if I could put you on the spot, when you kind of mentioned the comments here, are they things that you currently are doing, or are they things that if you had access to the toolkit, that would be some things that we should consider adding to that toolkit?
This is Brad. This is what we're currently doing. So
okay, great. Okay, sounds good. And Lisa says we're considering, and we'd love to be able to use the toolkit. So very good. Thank you, guys. And again, just to gives us an idea, and we certainly think about this more, and reach out to the Resource Center, or again, to Brian or me, and my contact information will be at the end of this presentation too. But we just love to hear ideas. We want to make sure that what we're producing is going to be the most helpful for you. So thank you. Okay, so as we look at, as I kind of mentioned, in terms of the communication, a lot of this is certainly to patients and prospective patients, and doing a lot of the things, the communication that people have mentioned to you already. There's an internal communication of this that is extremely important. In fact, it really, I could argue, is more important than the consumer part, because we have to make sure that we're on board and on the same page with things. So a couple things here. Again, as we're looking to have different providers adopt telehealth, or certain things that we need to make sure that we cover and make people comfortable. But then anything from, when phones are being answered to schedule something, or there, whatever it might be, different scripting. But then also a big takeaway that is certain etiquette in terms of how we provide those visits, and kind of going back to those points that I made earlier in terms of that empathy and that emotional connection and things like that. So as many of you are communicators, as we think about that you may be adapting your role in some way to really focus more on these areas as well. So to kind of give you an example, this top one is actually a challenge for me, because for one, my camera is at the top of my monitor. So I'm always kind of trying to make eye contact with people, but I'm not always sure if I am. So it's harder than it sounds sometimes. But anyway, making sure that the webcam is at eye level. I think it's a natural thing that when we're looking at a screen and we see a photo of someone, our intuition tells us we're looking at that photo of them, but we're not really making eye contact necessarily, or from the patient's perspective. So just being cognizant of that. Just be very aware of the space that's around you. Again, it's all about perceptions as well, whether or not it's video or not, in terms of what you have in your background, and those types of things, where certainly as from colleague to colleague, as we're doing things, we have certainly we're more accepting of our personal environments and things like that. But when it comes to a provider patient perspective, I'm not so sure that patients, they're still expecting this is the replacement for the in-person visit, so they're still looking for that certain level of professionalism and things like that. And just like anything else, being on time, all those sort of things, your attire, just in the same way that one would dress in a office environment, to have that through virtual visits as well. All the natural things that you would expect, being prepared. But then again, I was kind of mentioning about that eye contact is just really, again, this comes through a lot of practice, and some providers are going to be naturals at it. Some are going to need a little bit more training and a little bit more coaching, but just always being aware of, okay, what is the patient seeing? So even if you are looking away from the screen, to let them know, okay, I just want to let you know I need to look at this, or I need to look at this chart, or what have you, and I'll be right back, or whatever it is. And this is one that personally I struggle with too, as I do more of Zoom calls and things like that, but is leaving a few seconds between sentences to allow for either lag times, those types of things. It's very easy to unknowingly talk over the top of someone. So someone says something and it's hard, but just remembering to pause, things like that. Certainly being clear with post-visit instructions, and just always asking about their satisfaction with the visit and those types of things. So in terms of some of the communication, I'll kind of go through this fairly quickly as we have time for any other questions. But these are some various examples, and it looks like some of you are doing some of these things. And again, we'll look at what we can provide as part of the toolkit as well. But some things to kind of think about: how to check in, downloadable flyer, patient letters, patient brochures, direct mail, different ways to really share patient stories, whether or not it's through your newsletters or your publications. And frankly, there's and Brian will I'm sure talk about this a little bit at the storytelling part of things for next week's webinar, but even the use of video. Can be done very inexpensively to be able to share stories and do on your own, things like that. Really good way to share a message. So in terms of the external communications, again, many of you are doing the right things already, but just really being aware of what digital channels we have that aren't just social media, but just different ways that we're promoting, updating our website content, yes, but as we kind of talked about before, making sure that it's really easy to use, really, and again, I kind of get back to just an advocate of testing our different techniques and messages. So, yeah. And so these are some examples of how to do that. Some work that we've done with some other organizations, but just to kind of give you an idea of that. So before we kind of finish this out, I just wanted to also just kind of reinforce the point that I made earlier, is that the occurrence of COVID-19 has elevated the role and the importance of telehealth. But telehealth has been here for a long time, but so the good news beyond this is that as we are thinking about solutions for COVID and those types of things, that this really probably in many ways should have always been part of your strategy, and particularly with primary care. But now I think there's more of an environment where patients are more accepting of that. So to really think about that. And again, I would just echo that this is not a replacement for all traditional care. This is to complement the work that our providers do, and that it's part of the overall practice. So in terms of the future, every step that we take to build awareness, to implement your program, is a step in the future to where telehealth plays a larger role for your patients. And as we've talked about, as consumers continue to experience, the benefits, the convenience, the access, those types of things, we're going to continue to build that acceptance of telehealth as part of the toolkit for patient care. So in terms of a post poll, same question that we asked before, but just to kind of get a little feedback, is to see just based on this presentation, how confident are you now in your understanding of how to effectively communicate and build awareness of telehealth services, both internally and externally?
All right, it looks like 16% of people have voted. I'm seeing much more high confidence. We'll give folks just a few more minutes here, or a few more seconds. And I just wanted to let everyone know that the toolkit that Mike has referenced in this webinar will be ready the end of January, and we will be having another webinar the beginning of February to kind of show it off, really. So it's very exciting. All right, it looks
So-
like most people have completed the poll. I'm going to end that and share that with you, Mike.
Okay, sounds good. Oh yeah, definitely so.
Mhm.
So people are maybe just being nice, but yes. But I'm glad to see a higher confidence. That's great. That's great. So I think a lot of it is just knowledge is power, just being aware that maybe some of the things that you are experiencing are not unique to your organization. So just to know that. So I think in some ways that, you know, that is a big help in itself. So thank you for that. So just as a summary, and then Brian, if you're still on too, be happy to have you kind of, you know, help me field questions if there are other questions as well. So, so just in summary, kind of a couple of things that we've talked about here are, as we know, we have an environment now in which telehealth is becoming more accepting, and there are some opportunities for us in terms of rural healthcare providers, in terms of implementation and even reimbursement. Does provide more access for us. We do know that there are things that we need to do internally and externally to help communicate the benefits and to help to educate people. And there's certain tools that we can use to do that and adapt that. And that there definitely is a long-term future for telehealth in rural healthcare. So before we take your questions again, we've kind of talked about that next week, Mr. Lonnie is back, and he's going to be talking about the art of storytelling. We thought it was really a most appropriate time. It's going to be, what is your 2021 story? And keep in mind that the topics that we have selected for this series were based on your feedback, based on what you were interested in. And this one in particular was one that I know was high on the list. And so we'll kind of talk about different tools and techniques to use to creatively and impactfully share what your story is for your particular organization. So that's next week at the same time. So with that, be happy to entertain any questions. Again, if you have particular questions, you can always reach out to us separately, and we're happy to answer those for you. And I know again that the access to the articles and such and the presentation is available, excuse me, for your use as well. So anyway, happy to take any questions. Did you guys find this helpful at all? Anything that was a affirmation for you or anything like that? Feel free to chime in on phone if you'd like to, if anybody just wants to share anything.
Well, I know I certainly found it really helpful. I especially liked the tips for healthcare providers on how to be more, to foster that connection virtually, because that's a challenge for sure.
Great. Thank you, Kim. Lisa chimed in as well. So yeah, we're not looking for pats on the back, but from the group here, but we appreciate. I just asking, we want to make sure that what we're providing is valuable to you, and I think based on the feedback, I think that it is, but just always helpful to know. Any questions that anybody has in terms of any of the tools or anything that we've shared today?
One thing I was going to say, Mike, this is Brian,
Mm-hmm.
is that with some of the tools that we shared with you today, these are the types of pieces that will be in the toolkit. So with that, you look at it and you say, well, that's great, but how am I going to get a custom photo of my one of my providers on screen? The toolkit itself will allow you to do that. So there are some things that we're thinking about that through the teachings that Mike shared today that we're going to be applying to the toolkit tools too. So.
Sounds good. Okay. Well, thank you everyone for joining us, and have a good rest of the week, and we look forward to seeing you again next week.